Good morning. Good morning.
Good morning.
Hey, I just want to make sure you were alive and I was not talking to the funeral directors. Classes. So good. We're glad. I really appreciate the opportunity of getting to be with you today. We're going to have to talk fast, and especially because we're going to have 5 minutes in my notes. And I went through was an hour and 43 minutes. So I had to talk quickly. But I do want to remind you a little bit about my job at the hospital is to really be involved in patient satisfaction and customer service. And I want to share with you a few of the things that we talk about the resounding need of soft skills in our workforce, about other characteristics that we need. I want to just share a few of those real quickly with you. But before I do that, I want to read to you the mission statement from Madisonville Community College. And it reads, Madisonville Community College is committed to student success and improving the employability of the students. Personal and professional attributes and behaviors are necessary to be successful in college and also in the workplace. These skills include, but are not limited to, dependability, initiative, integrity, effective oral and written communications, teamwork, attendance, time management, and work ethics. Now, if you have all of these, you're going to be doing really well when you come to work with Baptist Health. There's a lot of things we need. But at the very beginning, I want to let you know that in my opinion, healthcare is a calling. Healthcare is not a job, but it is a calling. You are going into a field, a career that is being a servant. We're here to serve those who come who are in need. Patient contact is a moment of truth. And when they first meet you, when a patient first meets you, opinions are formed, and the impressions include things like character, efficiency, and friendliness. And a patient, you've all heard, a patient will decide about 7 things about you in the first 11 seconds that they see you. And they will decide at that point whether they like you, whether they dislike you, or whether they're going to be very indifferent toward you in the care that you provide for them. So that will largely depend on the satisfaction of the patient experience, and it will also depend on the level of satisfaction that you are as a caregiver. Some of the things that we need to learn real quickly about and be aware of, these are very elementary things that you've heard time and time again, but they're things that more often when we get busy we forget. And that's things like how to greet people. Always greet people with a smile. Let them know you care. The smile will really do a lot more than what you realize. Also, eye contact is very important because the eye contact with the patient also is equivalent to the trust level that they're going to have with you. And when you talk about those things, you have to think to yourself about that patient that you are my patient and you make my job possible. And also you have to think about when you greet a patient, there is something that I like about you. You're going to have a lot of really good patients, but you're also going to have some patients who are challenging to you. And you always have to think about that. There's something I like about you. I'm here to serve you and to make it better for you. Whether it be fluffing up that pillow, readjusting the bedspread on the beds, getting the towels on it that they've got out, whatever it might be. Also, you need to learn to listen. And this is something very different. You need to learn to listen to words. It's very hard right now because words are... Is that me? That's off. I'm off. Anyway, words are very difficult. We were just talking a minute ago that with the onslaught of cell phones, with our computers, with things like this, we are losing the gift of communication. And so we are having to relearn and readjust in our society how to talk to people and how to communicate. The name of the game is communicate, communicate, communicate. Listen to the words. Listen to the tone of the voice of the patients that you're going to have. You can learn a lot through that. And then you also, this is a little strange, but you also have to listen to their body language. Their body language can tell you a lot of things whether you are communicating with them or not. And then, pardon me, you want to help your patients say yes. That means that we have to know how to satisfy their wants and needs, how we can solve their problems for them, and also how we can help give them extra value. And so you also want to invite them to come back to do business with you, or to come back to your hospital, or your clinic, or whatever field you're in. You want to make sure that we thank them for using us and using our facility and choosing us as their caregivers. We also want to ask them to call or contact you if there should be a need that they have and that you're available to meet their needs, okay? Excuse me. Also, one other thing we have to know is when we're talking about hiring employees, one of the things that really sets a standard is the attitude of the person being interviewed. Folks, attitude is everything. Perception is very important. Perception can either make you or break you. But smile, have good eye contact, treat everybody with dignity and respect, provide a positive attitude, and your body language can also send out a message to the patient about whether you really care about them or not. Very, very important. So we come down to the last thing I want to mention right quickly is the phone etiquette. Phone etiquette is very important. We need to learn how to answer our phone with a smile. Does that make sense? We need to learn how to answer our phone with a smile. We need to think about the tone of our voice when we answer that phone. Are we really tuned in to who the caller is? Also, we need to be helpful. We need to be a good listener. We need to write down the message that you're getting and then repeat it back to that person. Excuse me, I'm sorry. So we talk about the qualities that we look for in hiring a new employee. We're looking for a lot of the soft skills, which include being friendly, being fast, being organized, eager to assist, being a team player, knowledgeable, optimistic, accessible, committed, being a team player, responsible, a decision maker, being a team player. Are you getting it? Communicate, know how to write and speak. So there's no second chance that we have, and you've heard that all your life, there's no second chance to make a first impression. So the impression we make on our patients when we first see them is going to be the outcomes usually of what they think about their level of patient satisfaction. The impression that you make on a patient is called your image, and you are the hospital. Wherever you go, trust me, wherever you go in healthcare, you're going to find people that are going to associate you, whether it's a restaurant, whether it's a grocery store, sporting event, whatever. They're going to know you as the hospital or the clinic that you work for. So your overall impression is created by your speaking style, the use of your nonverbal language, the level of your enthusiasm, and your appearance. Your appearance goes a long way for patients. And these qualities build trust in the patient that you have the ability to meet their needs. And so in closing, use the patient's names. Always call your patient by name. Say please, thank you. Explain options rather than saying no. Show genuine interest in the patient's needs and be empathetic. There's one little statement that I heard years and years ago that fits really well in healthcare, and that is to be kinder than necessary, for everyone that you meet is fighting some kind of battle. Thank you.